My primary emphasis is on foregut surgery, which includes the esophagus and the stomach. I see a large number of patients for various diseases of their esophagus, both benign and malignant, and specialize in treatment for those conditions. I order a TissueCypher on every specimen that I get back that has Barrett's esophagus as a finding, because of the fact that oftentimes, even though we may get a pathologic diagnosis of non-dysplastic Barrett's, we do know that a certain percentage of those will actually be a high risk for developing progression of their disease. And TissueCypher allows us to really predict those patients in particular who are at higher risk for developing esophageal cancer, which allows us to potentially intervene early and prevent the formation of the cancer. The feedback I've gotten universally when I tell patients their score has been relief, knowing what exactly we're dealing with. So for example, those patients who have non-dysplastic Barrett's who end up being low risk, reassuring them that this is a very low risk lesion, that pathologist was in some ways correct, that it's less likely to progress, and that we don't have to do routine surveillance as frequently, has been hugely beneficial. The flip side is those patients who I've found as medium or high risk, we can have a very different conversation about what their therapies are. And it allows them to have the knowledge that their Barrett's is not so benign as previously thought, and in particular those cases that are classified as non-dysplastic, which is what we've traditionally relied upon for our decision making. With the additional risk stratification, now we can decide on intervening, either treating their Barrett's or considering anti-reflux surgery or some other treatment modality. I had one particular patient that I can recall who was actually diagnosed previously with esophageal cancer and had undergone therapy, chemoradiation for this, and was undergoing surveillance at a different institution. He presented to my office as a new patient from a different state. And so I didn't have those records originally that he actually had previously been diagnosed with esophageal cancer. So I went ahead and did a surveillance endoscopy, found segments of Barrett's and sent those off, and his risk stratification came out high risk for cancer, which, going back through his history, really confirmed the value of the test, because we know already he has had cancer, and even though he had a very bland appearing Barrett's, which originally the pathologist described as non-dysplastic, actually had a high risk for developing esophageal cancer. Originally, the algorithm would have been to continue ongoing surveillance with endoscopies, in particular annually for someone with a known history of cancer, but now we are able to perform an ablation of his Barrett's. It's revolutionized the whole concept of screening for esophageal cancer. I think in the future, the concept of non-dysplastic and low-grade dysplasia really should go away. The ability for TissueCypher to actually tell us a percentage risk for development of esophageal cancer and high-grade dysplasia will allow us to intervene much earlier in the pathway to esophageal cancer.